Hello everybody. Let me turn this light down a little bit. See if I tap my face, if it takes some of that. I think I'm just gonna have to take my glasses off because it just makes too much shine. Let me know if you're here, and if you can hear me, just say hi. Don't be shy. I don't want to add a comment, but I want to see anybody who comments. If you're coming across this video, please comment and say hi so I know you can hear me. I'm just hopping on quickly because I have something on my mind that I want to share with you guys. I know we're busy studying. Okay, there's people watching, so comment and let me know that you can hear me. Give me a thumbs up if you can hear me. Lots of individuals, hundreds of people are studying with us right now. But I know it's in the back of your mind if you're a new graduate nurse. It's like, oh, where am I going to go practice? So I have a few things to say about that. I have been counseling people when it comes to entry to practice for a very long time. Ooh, I'm getting closer. And I have a lot of opinions, first-hand accounts. I need somebody to comment. Let me know you can hear me, though, before I go on, because I'm just scared that there'll end up being like a 30-minute video of me just and nobody can hear me. So comment and just say, yes, I can hear you. I see where I can comment, but I don't want to comment. I don't want to do that because that's going to close it out. I don't see any comments yet, so I'm not confident you can hear me. Comment, somebody say something. Maybe it's not showing me the comments. I can write a comment, but I can't see them. Come on, Facebook. Don't do this to me. Okay, you know what? I really want to see your... Oh, I see a thumbs up. Yay! Mel, can you comment and let me know you can hear me? Now I'm seeing them. Perfect, you can hear me. Thank goodness. I was like, how long am I going to sit here with them being like, get on with it? Hi, Emily! Okay, perfect. Hi, Sheila. Thanks so much for tuning in with me. So I have a few things to say. I'm feeling all revved up about this for a few reasons. One reason is because I know everybody studying with us right now is thinking about, thanks Mel, is thinking about entering into practice and what that looks like. And it's a really stressful time, for sure. I've been there. I understand it's a really stressful time. But there's some things I want you to keep in mind when you're making your decision about where you are going to enter practice at and how you are going to allow yourself to feel about it. So something you should know about me before I say much more is that I was a PSW for a very long time. That is a personal support worker. It's also known as a UAP, unregulated assistive provider, and a UCP, unregulated care provider. Old school, it was called a health care aide. But I worked in long-term care as a PSW for a very, very long time. It's how I started at the bedside, and I can tell you with all honesty, of all of the letters I have at the end of my name now, PSW is still some of my most, if not my most cherished letters at the end of my name. So I don't like add letters to the end of my name when I'm talking about myself or otherwise usually, but I do have a master's degree, so I am Ashley Bully, PSW first, PSW, BSCN, RN, MSCN. Okay, I got all those letters. Well, yeah, it's an accomplishment. It doesn't really stand for who I am. I mean, I was super excited to write RN at the end of my name when I first graduated school. Like, everybody's waiting for that moment. I get that, but that's not the point of what I'm getting at here. What I'm getting at is, why did I keep PSW at the end of my name when I have a master's degree? I once had somebody actually tell me that that was absurd. Why would I put PSW on the end of my name? Like, why would I keep that? I have a master's degree. Is it irrelevant that I was a PSW for 10 years of my life? Absolutely not. Absolutely not. The fact that I was a PSW before I became a registered nurse makes me a better nurse. Like, I am so proud of the fact that I was a PSW. It makes me a better nurse because I'm awesome at the bedside. I was already I had no issues with giving somebody a bed bath. I had no qualms about bedside care when I went into nursing school. I was already very comfortable with all of that things. Really, Ashley? All of those things. So I was super upset when somebody said to me, you should take PSW off the end of your name. Like, no. If I'm going to publish a research article, it's going to say Ashley Bully, PSW, BSCN, RN, MSCN. The fact that I have a master's degree does not erase the 10 years I spent giving personal care to elderly individuals in long-term care. Doesn't erase that. Doesn't erase that at all. If you ask, I get super passionate about this. If you ask any resident working, like living in long-term care, any long-term care resident, if you ask any of them who the most important person working at that long-term care facility is, who do you think you're going to say? Ask a resident in a long-term care facility, who is the most important person that works here? I have news for you. They are not going to say it's the nurse. They're not. They're going to say it's the PSW that comes in every morning and gets them washed and gets them dressed and helps them with their breakfast and wheels them down to the dining room and does all of the things. And I will say further to that, I've been both a PSW in long-term care as well as a charge nurse in long-term care. And I knew more about my residents as a PSW than I ever did as a charge nurse. Because as a PSW, you're with that person every single day. You're assessing that person's skin every single day. You know their habits, you know their skin, you know their bowel movements, you know their moods, you know when they're off, you know when something might be wrong. Any nurse that doesn't listen to what a PSW has to say is not going to be an effective nurse. You're just not. When I was a charge nurse in long-term care and I thought something was clinically odd about an individual just based on what I was seeing, I would go to the PSWs and I would say, hey, I'm noticing this about so-and-so. Is that her usual? Is that their usual, right? You will 100% be a better nurse if you listen to the healthcare aides and the PSWs, okay? If you're wondering if something is off about a patient, go ask them because they know if it is or not. I will never take PSW off the end of my name. Never, ever, ever in a bazillion years. And this gets me to thinking about where you're going to enter into practice. So, I've gotten a lot of messages lately from recent graduates who I taught throughout their 4-year degree or their 2-year diploma about where they should go work. And some of them feel a little bit of hesitation to say they're thinking of going to work in long-term care. Okay, I understand. Emerge nursing, trauma nursing, ICU nursing gets all of the hype and gets all of the, respect. Okay, I'm a trauma nurse. I'm an ER nurse. I know what it's like to be caring for 3 patients who are simultaneously dying. I know what that feels like. But think about this for a second. As a trauma nurse, in an emergency room, I'm surrounded by other nurses at all times, okay? Nurses that have been there for 25, 30 years, that have seen all the things, know all of the things. I'm also surrounded by physicians. I also have respiratory therapy on call. I also have all of the diagnostics at my fingertips. I also have, I could go on and on and on. I have lab techs. I can call this person, that person, the other person. I have 2 to 3 physicians, nurse practitioners, I am so well supported in that trauma room. There is little independent decision making that is required, okay, for success. But if you're a charge nurse in long-term care, which I have also been, it's you. It's just you. You are the one responsible for making clinical assessments. You are the one responsible for making clinical judgments. You are the one responsible for all of the stuff. There's no lab technician. There is a doctor on call, but you have to decide whether or not to call that doctor. So your assessment skills better be up to par. Plus, you're responsible for speaking to families as the authority figure. Plus, you're responsible for supervising other nurses as well as PSWs, health care aides, unregulated care providers, whatever it is you call them, okay? I've been the trauma nurse and I've been the charge nurse in long-term care. And I can tell you, hands down, the harder job of those jobs is being the charge nurse in long-term care. So don't think for 1 second that there is any shame associated to going and being a nurse in long-term care. There is no shame associated to that whatsoever. If you're a great nurse, you can stay busy in a long-term care facility when you are single-handedly responsible for 40 to 60 residents at a time. And it's just you. And everybody's coming to you with the concerns, and everybody's coming to you with the questions, and everybody's coming to you with the family, and everybody's coming to you with the clinical changes. And you need to have your ducks in a row to phone a physician at 2 o'clock in the morning that does not want you to call them. Okay? That is not easier than having a doctor standing beside you at all times. I get upset. Like, you could tell I'm all fired up. And that's because I've done both. And I see the stigma around being a nurse in long-term care. It's like, oh, the nurses that are, less confident go work in long-term care. The nurses that are less daring go work in long-term care. I've even heard, these are not my words. These are not my words. I've even heard that the stupid nurses, first of all, anybody that's graduated nursing school and passed the registration exam is not stupid. You can't be. Let's be honest. You can't be. But I've heard people say the dumb nurses go work in long-term care. Absolutely not. The nurses that are capable to work autonomously and do independent clinical assessments and come to sound judgments and phone a physician with confidence and feel competent being responsible for 40 to 60 individuals they know barely anything about are the nurses that are brave enough to work in long-term care. No Apple ID, not right now. And those nurses that are brave enough to do so will be 100% more effective if they are willing to listen to the healthcare aides, PSWs, unregulated care providers, whatever else you can call them, that work underneath of them, because those are the people that know your residents. So rely heavily upon them and you will be successful. I have worked with brand new graduate nurses in the trauma room, and I've worked with brand new graduate nurses in long-term care. It is more terrifying for the long-term care nurses because you are alone. You are alone. Like, you are the person. It's like, yeah, you get orientation and this and that, but it's like, okay, now you're the person. There you go. Now you're the person that everybody's coming to and looking to for answers. So the moral of my story here is, if you love elderly people and you are drawn to long-term care, don't surround yourself in shame about that. And I know that exists because I've seen it, and I've had graduates approach me and say, oh, I'm thinking about working in long-term care, but so-and-so was really hoping that I would work in the ICU, or I really look up to you and I want to be a trauma nurse. Yeah, I love trauma nursing. I love emergency nursing. I love it. I love it. But I also love the elderly. I also love long-term care. It will be my home forever. And I will never drop PSW at the end of my name because it is absolutely the most rewarding, some of the most rewarding and important work I've ever done. We're a team. Like, we really are a team. Nurses, PSWs, right? We need to work together. I have so many experiences as a PSW where I was like, shamed by nurses, made to feel less than because I was just a PSW, right? Or I would go to a nurse with a concern and say, I take care of Dorothy every single day, and Dorothy doesn't act like this, and I know something's wrong with her. And the nurse would be totally dismissive because, I'm just a PSW. What do I know? What do I know? I get Dorothy dressed every single day. I talk to her every single day. I know how she behaves every single day. I know what she eats at breakfast and lunch. This isn't her. There's something wrong, right? Listen. If you're going to go work in long-term care, listen, okay? The PSWs know what they're talking about. The unregulated care providers, the nurse assistants, whatever you want to call them, they know the people better than you ever stand a chance of knowing those people. No, they don't have your clinical judgment skills, but they will be able to detect a change in behavior long before you can detect that change. So have some respect, because you're going to be a better nurse for it, I promise you. Okay? Thank you for coming to my TED Talk. Honestly, I get so worked up. I get so worked up over it. Everybody thinks long-term care nursing is something to be ashamed of. Like, I use that term loosely. Everybody. I use that term loosely. But even students approach me. Thank you, Kathy. I'm very real and very honest, absolutely, and passionate. And sometimes passion can be mistaken as anger, which I'm very aware of. But it doesn't make me angry. It breaks my heart to think that, like, even me, I'd like to think I'm very positive and supportive and uplifting. And I sometimes have students and graduates of mine that I've taught in their undergraduate degree, for example, approach me with a little bit of, I can tell, with a little bit of hesitancy and a little bit of shame. And they're like, so, you know, I was a PSW while I went to school because I got hired as a PSW through nursing. And so they offered me a job and I don't really know if I should take it because, you know, I wanted to be a trauma nurse like you. And I'm like, are you kidding me? Tell me about working there. How do they treat you? How does the team work together? Right? There's no shame in that. You don't need to work in the trauma unit to be awesome. You don't need to work in the trauma unit to change people's lives. You know, you just have to care. You just have to love people. You don't need to, it doesn't make you less of a nurse because you're working in long-term care. It's harder. It's way harder. I love working long-term care. Dementia unit, me too. I love the dementia unit. That's where I was as a full-time PSW, was on the lockdown dementia unit. It is the most rewarding thing I've ever done. It's the whole reason I became a nurse. It's the whole reason I became a nurse was my experience on the dementia care unit. The whole reason I'm here. I have a question whenever you get the chance. It's somewhat irrelevant, but has to do with entry to practice. Let me see. What are your thoughts on starting out a mental health nurse compared to starting out a med surg? I've heard it's good to start on med surg and then specialize into whatever you'd like to go into. Good question. That's not an irrelevant question. So two things. Med surg is great if you're not feeling confident in your skills. So let's be honest. Some people graduate nursing school never having had the opportunity to insert a catheter. Like to actually physically do it. That happens. I've seen it happen. I take students to clinical. So I know that happens. If you're feeling super not confident in your skills and you want to hone those in, starting on med surg is a good idea. However, if you've had an experience in psychiatric nursing and you loved it and it's where your heart is, there's no shame in that either. Like mental health is just as important as physical health. It's no less, like equal, 50-50 as important. I graduated, like my best study friend that I graduated with, she's brilliant. She could have gone to work anywhere and she went directly to mental health and she's been there the entire time and has absolutely no regrets whatsoever about it. If mental health is where you want to be, go straight there. Go straight there. And we never stop learning. We never stop learning. So if you go to mental health and then you're called to go to med surg, then you do that. We're nurses. We learn for life. You can start in mental health and then you can switch over to a med surg unit and, you just be straightforward. Just be like, I'm super happy to be here. As soon as I graduated, I went straight into mental health. So I've never really had the hands-on med surg experience. So I may have to refresh myself on some of my skills. That's fine. That's absolutely fine. It will all come back to you. It's fine. Don't even worry about it. Follow your heart. Follow your heart. If there's any advice I can give you. Follow your heart and take no shame with you no matter where you go. If your heart is 100% in mental health, no, go. Absolutely go. Absolutely go. Go to mental health. If that's where your heart is, I'll tell you something. If that's where your heart is, that's where your heart will always be. Because if I'm being honest, which I typically am, my heart is in long-term care. My heart will always be in long-term care. I love emergency nursing. I love trauma nursing. I love the learning and the teaching I'm able to pass on from that experience, but it's not where my heart is. And you know how I know that? I light up like a Christmas tree when I get an elderly dementia patient. You know, the ones that some nurses don't have the patience for, that are trying to crawl out the bed all night long. I'm like, come to mama. Come to mama. I just love them. I mean, I love all of my patients, but they're my favorite. My heart will always be in long-term care. I just adore the elderly. I just adore them. That's where my heart will always be. Absolutely forever. So I totally relate to that. Follow your heart. Follow your heart. I love the relationship building in long-term care. I love the connections. I love the one-on-one time, how you really get to know people. There's so many beautiful things about it. You know, I try and make those connections, and some, depending on the capacity a patient comes in with, it could be challenging, obviously, in the emergency department. If the patient's unconscious, but usually there's always a family you can build a relationship with, etc. But follow your heart. Follow your heart. It doesn't matter if your mom was an ICU nurse for 30 years and that's the standard that you've held yourself to all through school. And then suddenly you find yourself in your experience drawn to hospice care. Your mom will be no less proud of you for going into hospice care. Like, you're no less of a nurse because you're not in the ICU. And I'm not discounting ICU nurses at all. That's not my point. ICU nurses are amazing. Emergency nurses are amazing. Long-term care nurses are amazing. Yeah, if your passion changes also, that's okay. That's another beautiful thing about our profession, right? If you get burnt out, if you get run down, if you need a change of scenery, there's so many different avenues for you to explore. And that's what is truly beautiful, right? That's what's amazing about nursing. There's no shame in any of it. You know, once you are a nurse, it's like the possibilities are endless, and there's never any, it doesn't matter where you are, where your career takes you, it's always going to be incredible. And if you're purposeful at how you behave with people, you're always going to be able to change somebody's life. That opportunity is always there if you are willing to take it. I'm telling you. I've done it with the hardest, most difficult of patients. I can tell you, if you want to change people's lives, you can. You absolutely can. I started nursing wanting to do labor and delivery, then changed to long-term care, and now I'm mental health, so happy where I'm at. A lot of people are surprised to know that I started into nursing school to become a nurse practitioner. Like, I wanted nothing to do with becoming a nurse. I was like, I have to get my BSCN first, so I'm going to go back to school, get my BSCN, and then I'm going to get my NP, and by the time it was done, I wanted nothing to do with being a nurse practitioner. So, you know, not to discount them either. I just realized through my clinical experience that wasn't for me. I got into med school. I didn't go because teaching is where my heart is. And now I would have been done med school, so there's times where I will like joke around like, oh, I would have been a doctor by now. But I don't want to be a doctor. And I don't feel shame that I'm not a doctor when I could have been a doctor, right? My heart is teaching. My heart is lecturing in front of 250 people and bringing them to me and teaching them something meaningful, right? Like, that's where my heart is. I know I'm home. I'm home when I'm in front of students. Because I think educators have an opportunity to shape nurses in just this most amazing way. So I just wanted to pass on that message. If you are having second thoughts about where you are or where you're headed, Lisa, talk about amazing emergency nurses. There's one right now that just joined us. There's no shame in it. Just follow your heart. Follow your heart. Go where your heart takes you. This career is going to take you lots of places, and you will learn every step of the way. There's always learning. You're always going to be learning. There's always going to be a skill that you haven't done, and, you know, who knows how long. And you're going to be like, whoa, I'm going to have to go look that one up, or what have you. Like, that's what happens. You have signed up for lifelong learning. Okay? That's what you've signed up for. So if you are going to need to refresh skills, whatever it is, you know, all of a sudden you got a peds patient and you haven't done peds math in whoever knows how long. The only reason I'm an ace at that is because I teach others how to do it. Otherwise, I'd be like calling on pediatric nurses. I don't know how to calculate a dosage based on weight and high safe dose and low safe dose. And what even is this? I can only do it because I teach it and I know it. You know, that's just an example of something that if you're not used to doing it all the time, you're going to have to ask for help, and that's okay. Right? It's okay. You're never going to know everything. It's not possible. You don't need to know everything. To be a great nurse, you need to admit the fact that you're never going to know everything. And you're going to have to ask for help, and you're going to have to go to nurses like Lisa down here that are amazing and know all of the things and have done it for so many years and say, hey, not so sure about this. What are your thoughts? No shame working in long-term care. Okay? No shame. If you are second guessing where you're heading or where you're at, send us a message. We're always happy to help. Thank you so much, Kathy, for chiming in about, you know, where you start in practice and where you're heading and where you end up, because like this career is pretty unpredictable and you might find your heart pulled one way or another. I know I'm speaking for Lisa when I say that she tried her hand in ICU, right? Like you can let her to other floors and see all of the things. That's the awesome thing about our profession. So thanks for coming to my TED Talk. I'm just feeling real passionate tonight at this late hour. You can tell I'm going to sleep well. I'm like all fired up, ready to give a TED Talk. About why I refuse to drop PSW at the end of my name, first of all. I never will. I refuse to. How if you're going to work in long-term care, don't take no shame with you and listen to those PSWs or healthcare providers, healthcare aides, unregulated care providers, whoever they are, because they know more than you do about those people. Okay? They know more than you do. I promise you. I promise you. They will know before you do. And if you're not sure, go ask them. Okay? That's my TED Talk for tonight. Thank you so much for joining me. It's been a pleasure. As always, if you're studying with us, hundreds of you are studying with us right now. We are available by messenger at any time to answer your questions. I'm more than happy to do so. Or if you're just catching this randomly from anywhere and you want to chat, we're happy to do so. Oh, thank you for tuning in. I'm so happy. I'm so happy that I'm not talking to nobody. Oh, Horia! Oh! May or may not be one of my most favorite students ever. How are you? Keita, I just see this is what it just lights up my life, my students. Oh. I know exactly who you are. I know exactly who you are. I hope you're well. I hope you're awesome. I would say it's so good to see you, but I'm not actually seeing you and you're just seeing me. You're the best. You're the best. Hi, Abby. Bye, Kayla. Oh, Kayla's sad she only had me for one class. Jessica's using your program and she loves it. Yay! Oh, I'm so glad. You better be supportive, mister. I know you are. Like, bring her all the food. Make her all the food. Make her all that good food while she's studying. Oh, I'm so happy to hear from you guys. I hope studying's going well, Abby. You can message me anytime with questions. I could just stay on here all night and talk to you guys. Like, I think one of my, I have 2 children. They're twins. They're boy-girl twins. They're 10. One of them is in a very important Fortnite event right now. And the other one is on her tablet talking to her cousin. And my husband is, I don't know what he's doing. But I was like, I'm fired up and I need to talk to my people. Unless you want to hear me talking about PSW work and how important it is. He's like, nah, I'm good. He gets enough of my TED Talks throughout the day, so. Oh, poor guy. Thank you so much for joining me. You guys can message me anytime. Hori, I'm so glad you said hi. Tell Jessica she's got this. She's got this. Mwah. Absolutely adore you guys.